shall we try and move on? And we'll do exactly what it says on the tin, and we'll skip over my report instantaneously, because I'm absolutely delighted to say John has joined us, and also Sarah Parker, and also Councillor Dave Evans, which is magic. And let me just say how important I think all this is, for two reasons. One is that whatever the government sometimes gives the impression, it's not all about acute beds and ventilation and hospitals. The pressure and the demands lie in and amongst our communities. And we are able to see COVID as a time of opportunity to work much more closely together, to have early intervention, to deal with the direct and indirect effects of COVID. And we cannot possibly go anywhere near doing that without really close working between ourselves and local authorities. And so today is auspicious from that point of view. And we're aware that Stoke has had problems with the young people side of what they're responsible for in the past. And I certainly am absolutely aware of the wonderful work that's gone on since then to recover that side of things. Because I've listened into presentations before, to be honest, but that's great. And if you're going to start somewhere in the community to improve things, then what more appropriate place to start than with children and young people? So, John, welcome, especially welcome that you're overcoming your personal COVID, and you've made it to join us today. Really, really good. Floor's yours. Use it as you will. And we've got you in slightly early, so hopefully we can take advantage of that and have another 5 minutes longer than we'd planned. So over to you, John.
Oh, thank you very much. And the batting order today is going to be Councillor Evans first, then Sarah, and then myself. And we're going to leave plenty of time for questions and discussion and challenge in terms of the presentation. We've let you have in advance, I think, a couple of documents, which was Room to Grow, which many of you will be familiar with, which is our new strategy, which we hope will be adopted and taken on board by the whole of the wider partnership. And the second is our improvement plan for children's social care. We're not going to do a PowerPoint today. You'll be pleased to know we're going to talk and give the narrative, and then we'll hand over to yourselves. But before Councillor Evans starts, there is one very important thing to do, which is to say a huge thank you to you as an organisation. On two levels, actually. The first is your patience with us as an organisation as we came to recognition and a realisation of the state of our children's services and the depths of the work that needs to be done, still needs to be done, in terms of improving those services. It must have been very frustrating to partners over the last few years, and that we weren't playing the role that we should have been. And then the second really is the positivity in which you as an organisation have joined in that process of improvement. I can particularly see that Chris Bird is on this call, and I want to particularly highlight his leadership and the contribution that he's made in a whole number of different ways over the last few months, while having all the other pressures on him with respect to COVID. And he's been a great friend, a critical friend, but rightly so, and always appropriate, and always willing to bring combines resources to the table. There are others as well, but I just did particularly want to pick out Chris because I think he's been particularly prominent over this period. So with no further ado, I'm going to hand over to Councillor Evans to set a bit of an overall context, and then we'll go from there.
Thank you, John. And first of all, I'd echo the comments that John made, both about our position in terms of our own services, in terms of children, but also the contribution. And I know you talked just about, during lockdown, during COVID, how that's brought organisations together and formed better partnerships. And I think certainly if you can have an opportune moment to build partnerships, in the case of children's services and Stoke, this was it. And I really do think we've made hay while the sun shone over the last eight months or so in terms of developing our children's plan and developing our children's strategy. And again, I know John mentioned Chris, and Chris has been really, really helpful, certainly in the forums I've been in with him. I think part of the discussion really is around what we want for children, not just as a children's social care department, but as a city, and what we are actually about as the city of Stoke-on-Trent. And I always say that we need a really strong narrative around children and young people. Ultimately, you judge a society by how it treats its most vulnerable, and there's no one more vulnerable than a child. Ultimately, they are dependent on adults, they're depending on parents, they're depending on services. And we've got to get to a place collectively where we can really drive change for our young people. We know in terms of children in Stoke-on-Trent, we have a higher rate of children not in education and training when they leave school. We have a higher rate of childhood obesity. We have lower literacy rates, all of which needs tackling and all of which needs driving out. And certainly in terms of yourselves, we also have mental health difficulties, as we know, and accessing mental health services is absolutely a critical part of everything we want to do, really. The plan itself, it does divide up, as John and Sarah will take you through in a moment, into a number of projects. But ultimately, the question I think we all need to ask ourselves constantly is that, so what? What difference do we actually make? And what is the real difference to a child's life? And we get wrapped up, I think, as services in terms of outcomes, in terms of what we think we want to deliver. But ultimately, the question I'm interested in, and from an elected perspective, I'm interested in, is what difference are we actually making? And it's that lived experience of children that I want at the front and centre of all of our minds as we move forward, as we develop our services and build those partnerships. Because ultimately, that's what really matters to me. It's what matters to the people in my city. I'm sure it's what matters to all of you. So that's all I've got to say, really. John, so it's Sarah, I believe, after me, isn't it?
It is, yeah.
It is, thank you. And thank you, colleagues, for inviting us to come along. I'm going to have to say a few thank yous. I'm sorry, I know this feels a little bit like the Oscars, but I would say since I arrived here, I haven't had the opportunity because of COVID to get out and meet people. So I get very, very excited when I see a lot of people on the call, because I can feel that I can kind of get that message out all at once. And for one of the I would say for me coming here to Stoke and just recognising what John was saying about the position of our children's services and David talking about the recovery. It's a long road, the recovery. You know, we unfortunately, we don't have a magic wand and we can't fix it overnight. And one of the things that I would say since arriving is the leap of faith that partners have taken in us, because I know that there has been at times exasperation with children's services. And I would say the leap of faith has really made a significant difference. The trust that we now have, I would say, I'm particularly proud of being new to the area. And I've also been exceptionally excited, delighted, and all those other amazing adjectives about the ambition and the willingness for people to come together around children and communities. So as a newbie to the area, I have to say that's something that has really, really struck me and stuck with me. So and keeps me going when it feels really bloody tough, because we know that we're not on our own. So thank you all very much. I am just going to, you've got the document, so I'm not going to run through it chapter and verse, but I suppose for me, there's just a few things that I would really like to pull out. And that is, it's come from the Children and Young People and Families Partnership. It's kind of old Children's Trust Board. So it's very much led by the partners across the city, including the voluntary community sector, health providers, schools, faith groups, etc. So I'm really proud that this is a genuine citywide vision for our children. This is not a council vision, it is a citywide vision. And we've got local businesses now even writing to me. We've got a big push at the moment to try and get some of our big employers to be fostering friendly. And they're actually quoting Room to Grow to me, which is really kind of blows me away, if I'm honest. So a genuine citywide vision here. It's genuinely multi-agency. I think there isn't anybody who can't look at that and feel impassioned by the ambition of the document, but also be able to identify their role in terms of developing it and coming together. So this kind of document really brings together all of our partners' priorities, strategies and plans, and we can all take that and really have a look at the strategic direction of our individual organisations and understand where we can make an impact. So in terms of making an impact, we've got some strategic measures in the document, and again around being safe and healthy, about achieving and being nurtured, and we can look at those strategic measures and really again identify where all our organisations contribute to those, so that we all have that real shared purpose and that shared ownership to improve the city for our children. In terms of the structure, if you like, around the actual document itself, we've got kind of 9 priorities from there, and those priorities, I won't run through them all, but I will talk of a few. First of all, it's around the new front door. So currently we have, I would say, we talk about MASH, we talk about a MASH system. We're having a new front door and this is about changing the way that we communicate and the way that we help and support and have conversations about families. I think at the moment there's a sense you've got to get something over the line, we've got to get to thresholds, but the priority around the new front door is about having those conversations, about getting in there early, being more restorative in terms of our relationship with professionals who've got worries and concerns about children and families. So moving away from it just feeling like it's about safeguarding to talking about any niggle, worry, concern that our professionals and families have about children in the community. Our early help ambitions, we've got our new early help partnership that's been set up, and already they've set up a new partnership board, and out of that we've got 4 specific priorities coming out of it around early years, adolescents, supporting schools and supporting parents. Again, you know, a wonderful example of how partnership has come together. We've got a health professional that is leading the work strand around the early years. We've got a school head that is leading the conversation around adolescence. So, you know, it's real evident about the role of the different partners in that work. A couple of other things, that we've got a big push around quality of practice, and that's kind of the seeing and the feeling experience of our children, but it'd be one of the things that will really drive the improvement. And again, we've been very grateful to our partners in helping and supporting us come together to review our stretches, our systems, our training. We've got some challenges around recruitment and retention, particularly around some of our qualified social workers. We've got some challenges around residential sufficiency, number of children coming into care. So, and I know that that is very much felt outside of the council as well, and I know that creates some frustrations in part, but the support has been really positive there. So moving on from quality of practice, there's a few other what I would call cross-cutting issues as well, particularly around inclusion, special educational needs and disabilities. We have got a formal inclusion partnership board that is due to meet for the first time in December, and that will look across all of the inclusion landscape. We've got a lot to do there. Spend is significantly high. I wouldn't say the provision is good. I know that if we have when we have our inspection soon, it's likely that we'll get a written statement of action. That board is high priority for both CCG and for us here in the council. It's going to be chaired by Marcus Wands and from John Rouse, and we'll be able to report back to you on how that's going in due course. Other issues are around children in care and sufficiency, I've mentioned, but also we've got an emerging strategy and work strand priority around education improvement. And again, that's not just looking at kind of reading, writing and maths in schools, but it's looking at the whole life course of preparing and being in a good place to be able to make the best out of an improved and exemplar education and learning system. So that is, again, looking at the early years, looking at school readiness, looking at the experience, the social, emotional journey of children through their education, and also ensuring that there is ambition. There's somewhere where those children can go and aspire to, because there's jobs, there's opportunities, there's apprenticeships, traineeships. So they've got something to really aspire to within the communities. I'll leave it there because, as you can see, I'm quite excited about the work that we're doing, and I could probably talk for Britain. I have to say, before I came, I challenged Councillor Evans. He said, I'm only going to talk for a minute. I said, you can never not talk for a minute. So I have to eat my bit of humble pie there. But I'll pause for a moment and hand on to John.
That's brilliant. Thanks.
Brilliant. So finally then, what I'm going to do is make this real for Combined in terms of zooming in on 4 key asks really of you. We start from a really great place, I think, in terms of the relationship with Combined, because two of our key conceptual frameworks you already embrace. So one is restorative practice. You got there well before us in terms of embracing relational models of engagement, and that's fantastic because that's an easy alignment. And the second is obviously the Thrive framework, which is a mental health framework which you recognise and use, that we're using now across the whole of early help and prevention. So we've got a fantastic starting point in terms of the way we see the world and therefore how we can join up. The biggest risk to us, I think, is that geography will get in the way. We organise on slightly different footprints. We have different frameworks and mechanisms, and we've got to ensure, and if COVID has taught us anything, is that we must ensure that we don't think just in terms of spatial footprints, but we think instead around how we create genuine wraparound support for that child, for that family, in the way that they're living their lives across different networks, both physical and virtual. And that's a challenge for us, but it's not insurmountable in the way that we go about our business. So those four key priorities. First of all, being an integral part of our early help and prevention offer. Being part of the teams out in the localities, out in the geographies, that is providing that early support to families and children before they tip into the need for more statutory intervention. Number two, support for our children in care and care leavers. And what I would say here is that this is always a challenge for mental health trusts. Why? Because fundamentally, these children have suffered deep trauma, and almost all of them will have some form of disorganized attachment as a result of the trauma that they've experienced and been through. And experience tells us that that doesn't necessarily always marry with NICE approved therapeutic interventions in terms of creating that bridge between mental health services and what these children have experienced. And I think we've got to work together on how we ensure that the provision meets need, and that we can actually really help these children to move forward and become successful adults. And then the third one is around inclusion, which Sarah's mentioned. A lot of the children we're going to be dealing with, have social, behavioural and emotional difficulties that are part of the barrier in terms of them fulfilling their potential, and that may need some sort of contribution or response in terms of the mental health input, but that's got to be deep within our schools. It's got to be deep within our early years settings if we're going to make progress. And then the final one, maternal mental health. Now, the key here is that we know, all the evidence tells us that the mental health of the primary caregiver is the joint best predictor of future life chances for a child or young person. The other is parental employment. And so it is absolutely critical that our maternal mental health offer is as good as it possibly can be to ensure that those mainly mothers are able to have brilliant early attachment as the primary caregiver with their child and children, and where not, that we're able to get that recovery as quickly as possible and get that relationship back to where it needs to be for the benefit of child and parent. So I'll finish there and hand back to you, Chair, and hopefully there's a bit of time for discussion.
That's absolutely brilliant. Thank you very much. I'll invite discussion. Can I just say how welcome it is to listen to the tone, the energy, and the practicality of what you've been saying, and above all, and Sarah used the word over and over again, ambition, because we as sort of leaders across the patch carry the burden of hope, and ambition is the word that enables us to do that better than anything else. So having said that general welcome, I've got loads of hands up, so let's rush in. Peter, do you want to start, and then Tony, and then Joan?
Yes, thank you. I'm just going to firstly continue the Oscars theme to say a huge thank you to Councillor Evans, John, and Sarah for your time. It's a valuable commodity at the moment, time is, given everything that we're going through, so a huge thank you. Just three things are for me, quickly, to pick up on. So firstly, and these I suppose are for me the things that jump out, that are maybe slightly tangential to the detail in the document, but the key things I think in my mind, and do align to the key priorities you described, John, at the end there in relation to how combined can help. So firstly, the voice of the child. So we had a presentation a moment ago from a service user that's also a member of staff, and those kind of conversations for us as a board are massively valuable. That's a lived experience piece. So that's a huge point for me in how we maximise the opportunity to listen to our children of Stoke-on-Trent. Access. So you've touched on access in various ways there. Now, for me, the key point in access isn't about maximising the number of points of delivery. It's about intelligent design and ensuring that we develop in such a way that does break down those risk of barriers in relation to different footprints and terminology that we use across organisations. So there's an intelligence that I know we're putting into this, but it's a key point for me around that access point. And then the third bit, and you know I'm going to say this, is the particularly yourself, John, is the ICP piece and link through to the Integrated Care Partnership. And I still believe that it's a massive opportunity for us, and continues to be, to ensure that this agenda is front and centre across a variety of agencies in Stoke-on-Trent and North Staffordshire. And of course, the other benefit of the ICP is that it does stretch across the whole of North Staffordshire, so it removes that risk of hard boundaries, as it were, in relation to the Stoke-on-Trent and wider conurbation piece. So the ICP bit for me is absolutely critical to ensure that we take a multi-agency approach to this, which is essentially, I think, the piece that you are describing really well today. But that multi-agency approach to the ICP is key. And a huge thank you again. I've said this before to you, Sarah, haven't I? A huge thank you again to yourself for your involvement, continued involvement in that. I'll hand over to others because I'm really conscious we may be losing people soon, time-wise. So thank you.
Let's keep moving. Tony.
Thank you. Thank you, John and team for the presentation. I think it was extremely helpful. I think the strategy itself is very straightforward, very straightforward to understand. I think in any strategy, the success of the strategy is that everybody understands it. And the people that really need to understand this are very much the young people and the families that are actually affected by it. What I don't see, and it's not a criticism, what I don't see in the strategy is a communication strategy that links all of this together. I see the partnerships, I see the work that needs to be done, but I think there has to be an overall communication strategy, to ensure that that the plan goes right down to grassroots level. And I just wondered where that fitted into the team's thinking.
Does somebody want to respond to this one before we move on? Communication strategy. All gone quiet.
Yeah, I'm just seeing if it looks like John was saying something, but John, you're on mute. I don't know if you want me to come in, John. No. I think you might be struggling to come off mute. Oh, there you go.
I'm off now, thank you. Sorry about that. I don't know quite what happened. I got stuck. So just first of all, to pick up very quickly on Peter's final point, which is we're completely committed to the ICP as an organising mechanism for the delivery of integrated health and wellbeing services for our children and young people, and we're really pleased that that has been named as one of the 6 priorities of the ICP. So I should have made that clear, but I'll make it clear now. In terms of Tony's question, I think it's a good. I think it's a very good point. I think I would have to be fair. I think I'd have to be honest and say that I don't think we have got a fully worked through communications plan at the present time. And I think that's partly about reaching the population, but I think it's also about frontline workforce and making sure they understand what we're doing and what their part in it is. And I think after we've done this high level stakeholder engagement through the boards, I think our next step over the next few months is to find ways of communicating effectively this strategy to a wider group. So thank you for that.
Okay,
coming to Joan, but Joe, on communications, did you just want to make a point?
Yes, I was simply going to say, obviously, for those of you who don't know me, I'm the Director of Communications here. Obviously, we have really good relations with your communications colleagues across, across local government and the voluntary sector and all of that as part of the wider system thing. Obviously, any help that we can give to you there, and I'll talk internally here, and we can talk with our comms colleagues across the patch and be of assistance to you in that. That's what we're here to support.
Okay, great. Thank you. Joan, and then maybe Chris.
Yes, thank you, David. And John, please get better soon. We really need you. And then can I just say thank you to all three of you for coming along and reaching out in the way you have to our board today. My question really follows on from Tony's point. And the thing that I'm grappling with, having sat on some of the ICP discussions that we've had, and looking at how our partnership policy at the Trust is going to go forward, is this issue about, Combined Healthcare Trust is a mental health care provider of mental health services. But I think we recognise that the way forward is to look at the whole determinants of health and health prevention agenda. And it's how we actually transcribe that into the work of the ICP, so that, if you like, there's opportunity for preventing people getting mentally ill or supporting those who have been and then might go back into treatment and preventing the readmission to hospital. How we actually do that through the ICP, and inevitably, because of COVID being the priority, and the sort of comments which Tracy's made about, in a way, there's almost a kind of built-in direction that the ICP is going to be about the hospital, and how we kind of direct that more towards bottom-up community development level. It's kind of what the mechanism is in terms of how we can actually, through the commissioning, because I think there might need to be a shift in the commissioning and in Stoke-on-Trent and Staffordshire as commissioners alongside the NHS commissioners. And I don't think that we've kind of fully understood that. And just to finish, the sort of discussions that we've had in the past about, for example, the drug and alcohol service. If we start to look at the absolute kind of specifics now, we all know that drug and alcohol, some of that kind of contributes to the childcare issues that we may have. And it's about having the kind of transparency and how we can work through the changes in your specific contracts on drug and alcohol, which I understand could mean as many as 50 people, 50 less people actually having access to the service, and then the need to kind of rethink that service. So how are we going to get those direct, trusted relationships between ourselves and yourselves as we make that transition?
Thanks,
Thank
Jo.
you.
I'm cutting in a little bit because we are out of the time we had, and I'm not quite sure whether we've got a few more minutes. But do you want to, John, respond to that before we try and squeeze another one in?
Yeah, I mean, so Sarah might want to comment on this as well. We have completely refreshed our children's commissioning strategy, and we've worked with health colleagues on that. And how we couch it is that we're moving from a transactional model of commissioning to a collaborative approach. And we're also trying to be more strategic in our commissioning and give providers more scope to collaborate and to work together to meet population need, rather than sort of saying you've got to deliver 20 widgets for this amount of money, which is incredibly restricting. And we're using the 0 to 25 public health contract, or that commissioning exercise, almost as an exemplar as to how we can commission differently in future, working with our colleagues at MPFT and the voluntary sector to create a different framework. Now, having said all of that, we are having to do it within a reduced envelope. And of course, that's a consequence of the level of resources which we have available to us as a local authority, and indeed pressures in the NHS as well. But nevertheless, with whatever pounds we've got, far better that we operate a collaborative, flexible model of commissioning. Sarah, is there anything you want to add to that?
Just to reaffirm what you said, John, and Joan, just to assure you, just looking at the public health contract that John referred to, you know, we've got some real challenges there around, like you said, the public health outcomes as well as the budget. And we've entered into, you know, we're looking at the partnership with our provider in the sense of working together to those solutions rather than dictating them right at the beginning in terms of we've got all the answers and we know what you should be doing. It's more looking at the lifetime of contracts and talking about our relationship and how we can work together for that public good. And it does mean a lot of trust. It does mean we need to be more flexible in terms of our commissioning approaches, the way that we contract, the way that we measure successes and outcomes. So I think it's a brave new world there. And I think that we're in Stoke only at the beginning of it, and it's about using this as an opportunity to get the foundations and explore how we can take that even further.
Okay, I'm hesitating now because we're just about at the end of our time. I wanted to try and make a bit of space for Chris, because Chris, you're in the middle of all this, aren't you? And was there something that a message you wanted to get across?
Yes, thank you, Chair, and thank you for indulging me. I know time's short, so perhaps important that I just say by expressing gratitude for the sentiments that John and others said at the introduction. I think I'm simply discharging the responsibility that was placed in me, both in respect of partnerships, but also I'm a conduit for this organisation. So you know, the feedback I give is collective feedback, both from execs and subject matter experts, but thank you nonetheless. And perhaps also important that I say to combine colleagues that we've had several opportunities to influence the design of these strategies, these documents. And when I say that, I mean direct influence, and we can see as iterations of the strategy have been developed that the contribution we've made has been considered and reflected within subsequent iterations of the document. And I think whilst it's been facilitated through City Council colleagues, there is a real sense for me that it is a citywide multi-partner owned plan, and it's really pleasing, at risk of understatement, to see that the emphasis now is on how we work together in partnership rather than why we should be working together in partnership. I really do think that the debate has moved on. One point for consideration, and this is a collective point we need to consider, is we've talked about a multi-agency plan, we've talked about ICP plan and our commitment to that, recognising the nuances on the geography. There are already some established mechanisms, so CAMS Transformation Board that operates at STP level. And of course, today we've got the consultation closing on the Joint Health and Wellbeing Board strategy. And if I remember right, one of the 4 key domains is start well in there. So as in other areas, not unique to children and young people, but as in other areas, between the City Council, ourselves as combined, some of our other important stakeholders, we've got a lot of strategies and established mechanisms pointing to the same areas. And I think there's a collective challenge for how we harmonise the energy that's being pointed into those areas and maximise the impact. So that's not for now necessarily, but I think in that delivery phase, we need to be really conscious of how we harmonise and maximise the impact we're going to have.
Thanks very much, Chris. I'm sorry, 1 or 2 other people wanted to talk, but I think in all conscience, we're probably out of time. I just wanted to say thank you. This is a pivotal moment, actually. You know, this has never happened before, and it opens up a channel of communication which we'll all benefit from. And I couldn't be more grateful to the 3 of you. Absolutely brilliant. Can I just ask one final question, which is, most of what we do in these meetings goes onto our website because the meeting's in public. Are you happy for this section to go in there as well? Can I just check that?
I think there's no problem with that at all. That's fine.
Good. Yeah. Needed to check. Thank you very much indeed. Thank you. And the rest of us are going to have a break now for 10 minutes. Okay.
Thank you. Thanks very much, everybody.
Enough.
Cheers.
And good luck with you.
Thanks for having us.
Thank you. Cheers. Bye.